Welcome to today's training video on arterial blood gas analysis. At IPQ, we are a nursing agency based in England. Please visit our website on ipqnursing.co.uk if you are interested in finding work as an agency nurse and for access to more of our educational material. The purpose of arterial blood gas analysis is to determine the respiratory function by measuring the blood content of oxygen and carbon dioxide and to measure blood acid-base balance. Arterial blood gases assist the assessment of severity of illness, the making of diagnosis, and are used to guide and monitor treatment. By gas exchange, we mean the transfer of oxygen from the atmosphere to the blood and the removal of carbon dioxide from the blood to the atmosphere. This is measured by estimating the partial pressure of these two gases. Partial pressure is the contribution of one particular gas within a gas mixture. Gases tend to move across a gradient from areas of higher partial pressure to lower partial pressure. At the alveolo-capillary membrane, air in alveoli has a higher oxygen pressure and lower carbon dioxide pressure, as seen on the diagram. Partial carbon dioxide pressure, or PCO2, is determined by alveolar ventilation, and the level of ventilation is adjusted to maintain PCO2 within tight limits between 35 and 45 millimeters of mercury. The deeper and faster the ventilation, the more PCO2 is removed. Increased PCO2, also called hypercapnia, implies therefore reduced alveolar ventilation. Ventilation is regulated in our brain by an area called respiratory center. This area contains receptors that sense PCO2 and responds to its changes. They connect with the muscles involved in breathing. If PCO2 is abnormal, the respiratory center adjusts the rate and depth of breathing accordingly in order to returning back to the acceptable range. Almost all oxygen molecules in the blood are bound to hemoglobin. The amount of oxygen in blood depends on two factors: the concentration of hemoglobin and the saturation of hemoglobin with oxygen. The diagram shows the oxy-hemoglobin dissociation curve, which pictures the relationship between hemoglobin oxygen saturation and levels of oxygen in the blood. The curve shifts to the left when PCO2 temperature goes down or when the acidity of the blood increases. The curve moves to the right when the opposite phenomena are the case. The term hypoxia indicates reduced oxygen delivery to tissues. By hypoxemia, it is meant reduced oxygen content, reduced PO2 in arterial blood. This could be the result of impaired oxygenation, of low hemoglobin, or reduced affinity of hemoglobin to oxygen. Impaired oxygenation refers to hypoxemia, which results from reduced transfer of oxygen from the lungs to the bloodstream. It is identified when PO2 is low. The diagram shows the basic concepts of these terms. Hypoxia can be due to ischemia, not enough blood delivered to tissues, or to hypoxemia, not enough oxygen in the blood. pH is a measurement of hydrogen ions in a solution. A pH of 7 is neutral pH. The human blood normally has a pH of between 7.35 and 7.45 and is therefore slightly alkaline. If the blood pH is below the normal range, this is acidosis, whereby when the blood pH rises above the normal range is called alkalosis. Extreme levels of acidosis and alkalosis are not compatible with life. The body, therefore, aims to buffer the levels of hydrogen ions and return them within the normal range by using several mechanisms. One of the methods for maintaining acid-base balance is through respiration. As mentioned previously, our lungs are responsible for removing carbon dioxide by adjusting alveolar ventilation. If carbon dioxide production is altered, we adjust our breathing to exhale more or less carbon dioxide. The bulk of the acid produced by our bodies is in the form of carbon dioxide, and as a result, it is our lungs that excrete the vast majority of the acid load. The carbon dioxide dissociation equation shows the relationship between carbon dioxide levels and the production of hydrogen ions. The respiratory buffer response is explained as follows. A state of acidosis in the blood, as measured by an increase in the levels of carbonic acid, is buffered by an increase in the rate and depth of lung ventilation in order to remove carbon dioxide from the blood through the alveoli. The opposite phenomenon is also the case. A state of alkalosis is buffered by a reduction in the rate and depth of lung, resulting in retaining carbon dioxide and therefore restoration of the pH within its normal range. The activation of the lungs is very fast, typically occurring within 1 to 3 minutes. The buffer response in the kidneys also follows the carbon dioxide dissociation equation. The kidneys secrete metabolic acids by removing hydrogen ions and by retaining bicarbonate. In its turn, the bicarbonate binds to hydrogen ions in the blood, resulting in reduction of acidity. In summary, the buffer response in the kidneys involves the following. In a state of acidosis, the kidneys compensate by retaining bicarbonate. In a state of alkalosis, the kidneys release bicarbonate. The renal buffer system is slower than the respiratory buffer system and can take hours or days to correct the imbalance. Disturbances in the acid-base balance may be of metabolic, respiratory, or mixed nature. Metabolic processes alter primarily the bicarbonate concentration in the blood. A decrease in bicarbonate leads to metabolic acidosis, while an increase in bicarbonate leads to metabolic alkalosis. On the other hand, respiratory processes change the carbon dioxide levels. As carbon dioxide is a respiratory acid, increase in respiration causes elimination of carbon dioxide and therefore respiratory alkalosis. Conversely, a decrease in respiratory efforts causes respiratory acidosis due to a reduction of the elimination of carbon dioxide in the blood. When we are asked to interpret the acid-base balance, the first thing to do is to assess the pH in order to determine if the blood gas is within normal range. If the blood is alkalotic or acidotic, we need to determine if it is caused primarily by a respiratory or metabolic problem. When the problem is respiratory, acidosis is associated with an increase in partial carbon dioxide pressure, and alkalosis with a decrease in carbon dioxide pressure. When the problem is metabolic, alkalosis is associated with an increase in bicarbonate levels, while acidosis is associated with a decrease in bicarbonate levels in the blood. Interpretation of compensation of acid-base imbalance. When a patient develops an acid-base imbalance, the body almost immediately attempts to compensate for it. As described previously, the main mechanisms are through the lungs and kidneys. When the patient has not compensated or only partially compensated the imbalance, the pH remains outside normal range, while a fully compensated imbalance is associated with a pH that has returned to normal range. This is a table presenting compensated, partially compensated, or fully compensated acid-base imbalance, depending on the driver for the disturbance. Respiratory and metabolic acid-base imbalance may occur simultaneously. In this case, there is mixed acid-base disturbance. The measurement of lactate levels in the blood is an important parameter for the assessment of tissue perfusion and acid-base imbalance. In a normal steady state, cellular energy can be mainly extracted aerobically. In contrast, when the body experiences inadequate tissue perfusion, anaerobic metabolism takes over, creating increased levels of lactate. Lactate measurement plays an important role in the diagnosis of poor cardiac output, poor tissue perfusion, and of sepsis. Lactic acidosis or acidosis due to increased plasma lactate levels is the most common cause of metabolic acidosis in hospitalized patients. It is defined by a low bicarbonate level in association with increased plasma lactate. It can occur due to poor cardiac output, local blood supply, or a generalized failure of tissue oxygenation. For your reference, here are some important normal values. Thank you for listening, and please visit us on our website on ipqnursing.co.uk.